Bridget Klingman. I'm Sister Bridget Klingman from the Dominican Sisters of Grand Rapids, where I am the promoter of justice for our congregation. I'm on the education committee of the U.S. Catholic Sisters Against Human Trafficking and have been part of the planning committee for this conference. So it's my privilege this afternoon to introduce to you Sister Ann Victory from the Sisters of the Humility of Mary. And she is currently serving as a member of their leadership team. She will be addressing us on how to build a strong anti-human trafficking coalition. Sister's background is a nurse by profession, has served as a clinician, an educator, and administrator in nursing at St. Joseph's Hospital in Lorain, Ohio, which is now Mercy Health. She is currently on the leadership team of the Sisters of the Humility of Mary. One of the lenses through which Sister Ann views human trafficking is as a public health issue, one that requires a collaborative, trauma-based approach involving multiple systems and service providers. And with that, I will pass this back to Sister Ann. If you have questions you want to address to her, please put them in the chat box. And toward the end of the hour, we will pull them up and pay attention to them. So, Sister Ann.
Thank you, Bridget, for the introduction, and I'm delighted to be able to talk with all of you today. As Bridget said, I come from a healthcare background, and I have served with the Collaborative to End Human Trafficking in Cleveland, Ohio, since its founding in 2007. I want to tell you some background about that because that's where I learned about forming coalitions. The collaborative began because there was a group of Catholic sisters in the area and some of our colleagues who went to a seminar, and it was on immigration. But the term came up, human trafficking. None of us had ever heard it. And when we found out what it was, we were very shocked and decided that somebody should be doing something about this. So that group, representatives of 7 different congregations in the greater Cleveland area, got together regularly with a couple of lay colleagues to figure out what it is that we could do. And we had educators, nurses, social workers, attorneys, administrators around our table. And we knew very early on that we would not be the direct care providers, but we all had networks among our professional colleagues of people who were doing the work with clients, with patients every day, and probably didn't know about this issue either. So we decided that our first approach would have to be raising awareness in the general public and also among our colleagues. So that became our approach. Now, the name of the group, we called ourselves the Collaborative to End Human Trafficking, not even knowing what collaboration meant, really. It was one of those flukes. I think it was the work of the Spirit, really, because we were all trying to stay out of God's way and maneuver in the way that the Spirit would lead us. So the collaborative over the years, and I'm still a volunteer for them, thankfully, began with lots and lots of education. That was our intro. So we did over 2,500 presentations over those years, reached 115,000 or so individuals. And we know it's still not enough because people still don't know. They still think if it happens at all, it happens somewhere else and never here. So we began there, and we still know that that education is part of our bread and butter. The other thing that was happening at the same time of this founding was that the Sisters of Charity Foundation in Cleveland was supporting efforts that were collaborative in nature among religious communities. So this gave us an opportunity to get some backing for the work that we wanted to do. And they have remained a consistent supporter of the work. So part of our mission was raising awareness and education. Another part of our work was what we called connecting services with providers of all sorts. And that is the area that has taken us longer to figure out and how to do well. But it includes meeting with local agencies and organizations to begin learning about the issue. And one of our first efforts was to find out, well, what do they know? Who knows what about the issue? So we did this simple little survey of some of the providers in the area, some of the social service agencies, law enforcement, colleges and universities, and asked them, what do you do with persons who are being trafficked? And they'd look at us sort of cross-eyed and think, what? So they didn't know. And when we described the kinds of persons that we were talking about, oh yeah, we see people like that. We see kids like that. So it became a learning opportunity for us to begin teaching them as well, and then formulating a group that would perhaps be able to work together. So that was the founding, or the sort of gathering that began us. And we called that group initially Housing and Services, for lack of a better name. So that group began meeting as well. I'm going to share my screen so that you have some information about our efforts going forward and where it has led us in building our coalitions going forward. So that was the start of where we are and what we learned. Now, I mentioned that we called ourselves the collaborative, and not knowing what that meant, but we had to learn. So we began by exploring what that really means, and found out that, collaboration isn't really the goal, it's the means to the goal. So it's necessary to figure out what is it, what isn't it, because it's a popular term. It's a catch term that keeps being used a lot these days. And what we've learned is that getting together to share ideas and then going off and doing whatever we want is really not collaboration. But some have determined that it is. It's much harder than that, or much more challenging than that. And we've learned that it's a process, and it's a process that has several steps to it. So sometimes coordination is like the first step for working together. Let's just coordinate what we're doing and see if we can do better, if we can do it with each other. And then cooperation is a step along the way. It requires maybe a bit more intensity, maybe a little more skin in the game to really cooperate with one another, because you might have to give and take a little bit more if I'm cooperating. And then collaboration is really like the most intense. Organizations agree to influence and be influenced by one another. So all these methods are needed depending on the kind of work that's being done and the goals and purposes for doing the work together. So being deliberate has become very, very important. Having a mission, having a vision, having some desired outcomes that we share together. Now, you may have questions or comments along the way. Please put them in the chat, because I want this to be interactive, and I'll probably stop early enough to allow that. So one of the things we learned, that sometimes what happens is more collaboration. So in a group that's doing collaboration, there's some suspicion involved when people get together. They don't know where the other person is really standing. It's maybe less formal, and people are cautious about what they share and why they share it. There might be a focus on assigning blame or assigning credit to one or another in the group. And so there's some caution around that. And people participate perhaps to protect their own interests. They don't want anything negative about them. And options tend to rule. There is no formality about this. So the options rule, and I can say something or not say something or back out or take what I learn and apply it somewhere else. And it's a lot of talk. And maybe there is a different approach. When you think of collaborating, there are some different things involved. There has to be a level of trust for people to really collaborate well with one another. And it needs to be intentional, and it needs to be somewhat rigorous, that we're coming together for a specific purpose. We want to stay focused there and build the relationships with one another so that we can have that trust and that intentionality. So the focus then becomes, what's the system outcome that we are looking for? So we in our area wanted to focus on a safety net for those affected by human trafficking. So that became the mission. The focus was on developing that and working together to make it happen. People, organizations, agencies participate in order to generate some value toward this effort. And data is king, and this is a tough one because who has good data on human trafficking? Nobody does yet. We certainly don't in our area, but it's always on people's minds. Who's counting what? That's one of the efforts going on right now. Which of our agencies count what? Are we duplicating the same persons or not? How do we know? So it's a conundrum at this point. We just don't have it, nor does the state, nor I think does the nation. So the engagement of one another, though, is what leads to action and outcomes and change. So it's a challenge. We know it's a challenge. Some of this information is coming from a book entitled Collaboration, a handbook from the Fund for Our Economic Future by Chris Thompson. And I put that reference in the chat box. It's a very simple 60-page manual. It was not written for our particular kind of work at Collaboration. It was written more for economic development in the region. And yet what's presented there has become key. It really resonated when I finally had access to that book. It's, yeah, that's what we've been learning too. That's how it works. And that's what doesn't work. So what does it take to do this work well? We're finding that with human trafficking, addressing the work depends on where we're coming from. We know that the federal law addresses prevention, prosecution, and protection. We know that the Trafficking Victims Protection Act is right there. And what they have learned is the value of partnerships. And partnerships for us is a way that we do collaboration. So that serves as the pathway to what we are trying to accomplish. We can't do it alone, can't do it just one agency at a time. We can't compete on this. That destroys it for everybody. So where do we go? That's our pathway, and doing it together is what can really, really help us. So what does it take to build a coalition that is really collaborating? I've found, and I think a number of people have found, that building relationships needs to be the first step. And that can be pretty challenging because it takes time. It doesn't happen overnight. If somebody's coming in and I've never met them before, well, there's obviously going to be some level of what are they about? What do we know about them? Are they really on board with this or not? Building the relationships take time. And then staying focused on the mission is absolutely critical as the group progresses. Welcoming different viewpoints and different ideas also helps the coalition become perhaps more broad in their thinking and accept the viewpoints that could really make a difference. And we found that the style of the leader for this effort needs to be one of facilitator. rather than command or control, which doesn't always work. It isn't inclusive. It isn't inviting. It's the facilitator style that seems to work the best. And even though that sounds easy, we know it's not, because it's like keeping everybody in the room on the same page with a focus. We knew we didn't have to be, as the collaborative, we didn't have to be in charge. We just needed to facilitate the mission. And it certainly involved regular communication to all those who are participating. Now, what do you expect from something like this? Well, the first thing you expect is it's going to be messy. No two ways about it. It's not going to be simple. It's going to be messy. It isn't a smooth ride. There will be ups and downs. There will be disagreements. There will be people that come for a while and decide, nah, not for me, I'm backing out, which is okay. It's going to take more time than you might ever want, because that relationship building takes time. You have to spend the time with individuals or representatives from organizations to get a sense of what they do and what they have to contribute and want to contribute. There will be people who participate only because they don't want to miss out. We call that the FOMO phenomenon, fear of missing out phenomenon. So they'll come because they don't want to miss the information. It's not that they necessarily want to participate and share their insights. But a faithful and committed group will emerge from the process. It takes time, though, more than you want. And when you're feeling urgency about an issue like this, you don't want it to take the time. However, taking the time will save you in the long run if you do it well and do it up front. So where do you start? How do you begin? Some of you have probably learned this already. Inviting those who may already be working on the issue to get together. Let's talk about what we're each doing and see how we might do it better if we did it together. Since with this issue, nobody can do it alone anyway. What can we do together? And always ask, and that question is still always asked every time the local group here gets together, who else should we be inviting to be around our table with us? Because they have something to offer that none of us is offering yet, or we could offer it better if we had their input. And then learn about the agencies and allow the whole group to learn about the agencies and the organizations who are involved. So a portion of every meeting of this group, which meets every other month as a large group, there's a focus on a particular agency or organization, or maybe more than one. Short, but what do you do? What do you not do? And what help do you need from others? So that people get to know how to use what they have to help another agency or organization focus on the mission and provide the kinds of services needed for those who may be being trafficked. And the other piece that comes from that larger group is finding out what will work or maybe not work in specific kinds of settings. Because, for instance, what we do in healthcare may not ever work in a law enforcement setting, or what we do in social services may not work in the hotels that we work with. So it's that kind of interaction that helps us to get to know each other and to work better with each other in providing services toward that common mission. We always want to include the perspectives and the expertise of survivors in guiding us in a response that will be most effective. So those are some of the places to start, and it's ongoing. You start there, but it's not ending there. There's more to be done. So we wonder, well, is it really worth it to do it this way? Is it really worth it to take the time? I'll take some time, a little bit of time, to describe what has been the effect of the work of our collaborative to end human trafficking, and what we've been able to accomplish. We found that partnership and communication is a key component of collaboration. And the governor addressed this in a report that he gave in 2017, building collaborative relationships. When agencies and organizations collaborate, outcomes are typically better for survivors and for investigations. Now on this slide, you'll see one of the public awareness efforts that the collaborative did together. We have billboards around the city, and these are also available on bus signs and airport signs that say human trafficking happens here too. They have different faces. They are situated right now around the city. They go up periodically because it's a pretty expensive proposition, and we had grant funding to help with it. But it helps people be aware that look around your own neighborhood. This is where it may be happening. And the collaborative does get phone calls based on what the billboards say. And there's a website to refer them for more information. So that's been effective, and it's been the work of the group that brought that together. What should the message be? How should we display it? What kinds of images should we use that would be acceptable and appropriate to place in such public places? So the group really came together. We started way before this, but the group really got situated when we had news that the Republican National Convention was coming to Cleveland in 2016. That's when the group got formalized. We thought, we better have our act together since this national spotlight will be right here in the city, and we don't want human trafficking happening around or during that event. So the group formed some committees, one being public awareness. So that's when the billboards originated and went up, and the bus signage and the airport signage. So it was out there before the convention happened. We also knew from consultation with the Polaris Project and Bradley Miles at the time, who was the CEO, that a lot of this will happen in hotels. And so your hospitality industry needs to be prepared to know what to recognize and how to address the issue. And we also know that in a broader context, there's a need for response and intervention. So our healthcare providers need to know, our public safety providers need to know how to respond to this very complex issue that may be in the spotlight during a convention. So that became an impetus for us to get things in place. Now, what it resulted in were a number of groups really intentionally becoming part of the collaboration. So we had a group that works with homeless and missing youth on the streets, Belfair. We have therapy and counseling groups. We have our elected officials involved. A hotel in Cleveland, Loft. Renee Jones Empowerment Center, who offers support and guidance for those who have been victims of human trafficking and other violence. Victim advocacy efforts, the SOAP Project. Hotels and lodging, and I'll say a little bit more about that later, about what happened because we were working with them. Legal services, legal aid is involved. Our healthcare providers in the city working together on the issue. Law enforcement working together on the issue. The Cleveland Rape Crisis Center, one of the key players as well. And many other groups working together. So what has come out of that? What are the outcomes that have happened because the group was working together? I'll list a few of them. One is that our healthcare providers decided that we needed to work together on the issue. And that came about, it was very organic, the way it came about. It was not coming from the top at all. There were some nurses from the various health systems in Cleveland and some social workers who were at a meeting, and we were talking about the issue of human trafficking. And one of the nurses said, you know, I think we may be seeing victims, and I don't think we have a way to respond very well. Another nurse from another system said, well, I know we're seeing victims, and this is what we're trying to do. And a third one in the room said, can I be part of that conversation? We need to figure this out. And we determined together, and because I get to be Switzerland, I don't work for any of the four biggies. I sort of moderated the group, and we talked about what do we need to do to help our healthcare providers address the issue appropriately for the sake of victims. So we talked about that for a while, and as this group, nurses and social workers primarily, came up with what we thought would be appropriate guidelines. But before we did that, we thought our hunch is that they don't know, or that our healthcare providers don't know the issue. So we did a survey first. It was a paper pencil survey, pretty simple, distributed to 6 different emergency departments in the 4 different systems. And we got a very positive response of 197 responses. So we thought that was pretty good. And it was nurses, it was social workers, it was physicians, physician assistants, nurse practitioners, even secretaries who responded to that survey. And they confirmed our hunch that they didn't know much about this at all. It also confirmed that they were wanting to learn more. They didn't feel confident that they could interact with a person suffering because of human trafficking, but they wanted to learn. And they wanted to learn by scholarly articles, by videos that they could learn from, and by in-person classes. So that bolstered our efforts. We knew at 2014 there were not many scholarly articles. There weren't even many videos that could be helpful. So we thought, well, why not make a video ourselves? We had never done that before, didn't know what it would take, but we got a grant to do it and put in that video the guidelines that we came up with and scenarios of how to respond in situations where you suspect human trafficking is going on. We used local persons, physicians, nurses, social workers, a local survivor, and we filmed it at all 4 systems. So the systems had some buy-in because it was being done right here. And because it was local, they really put their names behind it and helped with that effort. That video is still available. It's under revision right now because some of the things have changed, like phone numbers, like who's the person or the appropriate agency to call. So we're revising some of that video right now. Another example is with police officers. What do they need and how do we get that information to them in a manner that is effective? And so people from the coordinated response group who were part of law enforcement decided one of the things that we want is our first response to be, we're going to take people that we suspect are being trafficked, we're going to take them to a hospital. So that really upped the ante on healthcare providers to know what they're doing. But it also established a relationship that was a little stronger between healthcare and law enforcement. Gave us that opportunity to work together, get to know each other, build those relationships so that if Nurse Susie calls in the middle of the night, the task force, they know that she knows what she's talking about. We need to respond. And so they develop a very strong relationship. They wanted, though, to get the information out to all the police officers in the region. Now that's 88 police departments, over 5,000 officers. How do we help them? Well, one of the ideas, of course, was put the information on the back of a name tag so it's ready reference. And our police officer said, you know, those are going to go in the washer. They're going to be destroyed after the first wash. Let's find another way. So what they came up with was what they call a ticket box card. I don't know if you've ever been pulled over for a traffic violation, and the officer gets out of his car and he has a metal box with him, usually, that he used to write on. But inside that metal box are his tickets. And so they wanted a card that could go in that box to help them know what they should do if they encounter someone who might be being trafficked. So those ticket box cards have been distributed to all 88 police departments in person rather than mailed to them or any other method, because we wanted the relationship building piece of this to know how important it is. So the officers have their cards and they are using their cards. We've had feedback that it's been useful for them and they want some further education. So we're devising ways to help them with their roll call meetings and provide them with additional information on human trafficking and its complexities. So that was another effort. Because we worked together, we could make that happen. Could law enforcement have done it by themselves? Maybe, maybe not, but that card is helpful to them with what to look for and then what to do when you see it. Here are the places that have sexual assault nurse examiner programs in place. Take the patient to one of these facilities because they know how to address the issue. You don't have to be transferred again. The information collected will be shared with you as appropriate. And so you don't have to do multiple interventions or interviews or interrogations. And then the third effort was around educating our hotel staffs. Our hotels wanted this to happen because they know human trafficking is not good for business. When you think about it, it's very bad for business. So those who were members of the Ohio Hotel and Lodging Association were eager to put together something that would be helpful. So we worked in conjunction with them to come up with what they desired. They wanted a 30-minute educational presentation in person. This is before pandemic, so we've had to modify, but in-person presentations for their staffs. And they also wanted big posters to put in their workrooms so that they could have in front of the staff a reminder about how to respond to what might be the red flags. So the poster contains red flags and what to do if you think you see them. And for our hotel staffs, they didn't want the housekeeper needing to call for the help. They didn't want the food service needing to call. They wanted the staff to identify and to notify the general manager or the security staff on duty so that they could make the decision about calling the task force to respond to the issue. And that too has been very helpful. And we're continuing that effort because we had to put things on hold due to the pandemic. And so many staff still need the information. The next efforts are going to be around what do we do with our education systems to do better with making sure that our administrations, faculty, students, and teachers and support staff know what human trafficking is, how to respond to it well, and in addition to the parents and the students themselves. But the best way to get to students really in a systemic fashion is to get to the teachers and the staff. So that effort is still going on. So these are just some examples of what can happen because we're working together, since none of us can do it alone. And I would really be interested in your questions. And I see that there might be a couple. One is, how has COVID changed or hampered your work? Well, certainly there has been an impact because we haven't been able to progress with the things we wanted to do. I told you about the hotels. We had to put that on hold because they don't have their staff there. And it hasn't been helpful to even try to do it with them. Our law enforcement has continued to operate and they do respond to any calls that they get regarding human trafficking. They want to do the investigations. They don't want any other person trying to do it alone. That's way too dangerous. And the effort with the schools is still a work in progress. The teachers are already overwhelmed with having to deal with teaching in different manners and trying to get the school system on board with everything else that they're facing. But we believe that's a very necessary effort. And I've been trying personally to get to the Cleveland diocesan schools and their administration. So we're hopeful that we can make that happen. We thought we'd start with a small school system. The first one's expressing a lot of interest were the Cleveland Metropolitan Schools, which is a huge district. But we have been working with their teachers through their teachers union. There's a lot more to do. So I'm going to stop the sharing and see if there are more questions.
Sister, I don't have a question, but I admire the way you have functioned on this whole thing. But I was thinking while I'm sitting here, is I'm a member of a Sister Sorrowful Mother, and we have hospital like in Kansas, in Wichita. We started our coalition right away. It started from our ER state, and we have a nurse who was a forensic nurse. And during her master's program, she decided to focus on that whole thing. So we were able to do a protocol for like what to be thinking. As soon as we know on a suspect, they call the police. And from there, we decided also to educate the doctors. We have presentation for doctors, especially in that one hospital, presentation to doctor, nurses, and things to recognize that, and invite police people too. The education part is very important in the whole coalition, and district attorney got on board. Everybody got involved because of the way we have approached this education thing. And in fact, I just want to, I'm very proud of it. It's one of the most successful because our protocol that we did for Wichita, Kansas, become the CHA and all other institutions use our protocol of identifying. They have a very well written protocol and things. But that's what's nice when you do cooperate with everybody who's supposed to be involved. And
That's
so
true.
I'm so glad to hear. I'm so glad to hear that from you, because you see, we don't have enough sisters to work with me. So a lot of times what had happened is we are fortunate to be able to give grants to different organizations on human trafficking. And so I'm coordinated with them. And it was very successful working that way. Thank you. It is really very good to collaborate.
Good. There's a question in the chat from Lynn. We have a coalition. Do you see that as collaboration? We have common goals and actions. I guess, Lynn, that would be for you to determine. You're certainly on the right steps. It's that relationship building. It's that continuing to share the common goals and the focus, keeping focused on the mission that can make that happen. And it does require effort. It doesn't happen overnight. So it is a challenge. There is another question about how has COVID changed or hampered your work? And I think I pretty much addressed that. I think it's going to be a challenge for a while yet, because people are pretty distracted by what COVID is doing, for example, in schools, and the concern about children being affected by it. There's a question from Jean about with turnover in coalition membership, how do you keep the group all focused on the same level of mission and goals? I think that's part of the communication that has to keep happening and keeping people engaged. Right now, the coalition members stand at about 67 organizations. So that's a huge number to keep in line and on board. And some will have varying levels of involvement. And yet, so keeping them engaged, keeping our interest in them helps that to happen. It's the communication. We have to communicate very regularly with them and invite their input on things that we think could help. Or if we don't know, ask, do you have an idea about this? Can you help us do this? Another question, do you work on change of law regarding the equality model. In the state of Ohio, we've had a lot of instances for working on the law together and trying to get a law. We were pretty basic at that point of our law, the only state in the nation where the age for being considered a child was 16. Well, being considered adult was 16 instead of 18. So it took years to get that changed. So now across the nation, there is a common age. So that advocacy work was happening throughout all the area agencies that are working on the issue, wanting to get that law at least the same as the federal law. Now getting it enforced is another effort. Getting our courts involved so that they recognize and can address the issue appropriately is an ongoing effort as well. Yes, we have a docket for adults, and yes, we have one for children who may have been trafficked, and that work is ongoing. So we keep learning. I guess being open to the fact that you keep learning from it. One of our challenges was that we have the LGBTQ community as part of the organizations that we work with. And some other agencies and organizations sort of object to having that kind of membership. We need that kind of membership. So we're continuing that. And if another agency has a struggle with that, it's up to them to work it out, because we know that's a very vulnerable population and we need to work together on it. Other questions?
Yes. One of the members of our group pointed out to us that hotels have a very high turnover of employees. And so a one-time educational process or one-time certification by EPCAT may not be sufficient.
Right.
So is there a schedule, for lack of a better word, returning to these hotels to redo the training as their turnover increases?
We're working with them to do just that. How can we stay engaged with them, work with them on their schedules to see when they want it? We've trained a number of people who would be able to offer the presentation so that they can, we can schedule it on their time, because, you know, sometimes it's going to be evening or early morning, just like in a hospital setting, they work at odd hours. So we have to accommodate that. And so that work is going on as well. Other questions? I'd like to know some of your experiences. What have been your experiences, your pluses and minuses with building coalitions? Jean?
Not to answer your question, I don't have that much experience, but another question is, do you feel that coalitions require some type of funding support in order to really function? Does a coalition have to apply for grants or get funders involved in some way? Or, you know, to what extent is money a limitation or an advantage in a coalition?
That may depend on what specific kinds of work the coalition wants to do, I would say. We had some specific things that we wanted to do that we knew would cost us money. So among all of us who were working on this, we figured out what sources of funding we could get and to whom we should apply. And in our case, the collaborative became the one to receive the funding and then use it. But that can be worked out among whatever the group decides will be the best. You might need a fiscal agent in order to accomplish some of those goals. And it does depend on what you can do. And many organizations were very good with offering services as opposed to offering financial piece to what they could make posters. They could offer their graphic designer to do certain portions of the work. So those kinds of things come into play. The sheriff's department, who houses the human trafficking task force in this region, paid for all the ticket box cards. They were willing to do that. I think it's because of the relationship building. You become credible as you stay with it and maintain those relationships in a manner that shows that you're really committed to this and you want to do good work and you want to do it together. You're not trying to take over anybody's job. Other questions or comments?
I just want to make a comment about the funding thing. What people who receive grant and all of that whole thing, they're very good in cooperation and collaboration. That's how I am operating with because we have the benefit of giving grant to different organizations. We have 8 of them throughout the US, the whole thing, and they really work very well because they have the money, they have to function and kind of like that. Grant writing, we encourage them to do grant writing, but we also have funding that we support all the organizations that we are sponsoring.
Thank you. Another thing we've also learned is that as Catholic sisters, we don't need to be the ones in charge. Someone else can take the lead and do it very, very well. We can join in the efforts of a coalition that may be local, and we can add our input, which is in some cases pretty unique, because we've pretty much learned about compassion for those who are suffering, those who are poor, those who are disadvantaged. We've also learned a bit about collaboration because we've had to. When we think about it, we never did any of our ministries all by ourselves. We always had to build on relationships to help us do the work at hand. And not even knowing necessarily consciously that we learned those things, those have come into play in terms of building strong coalitions. So we don't even have to be the builder of the coalition. If we can participate in a coalition, we might strengthen one that's already existing, and we have a lot to offer in that regard.
I agree.
Other comments or questions?
Our human trafficking task force started with 4 people who had gone to a 3-day training in San Francisco and came back and had said they were committed to starting something. And we have about 65 organizations that are part of that now. And there was talk about writing a grant and it never happened. And someone suggested having an annual summit. So we do have a large summit. There were 200 people at the first one when we could have people present. It's been pretty successful online. We don't require an amount of money, but we do ask for people to make a donation. And that's been a very good source of raising funds. So that's something that folks could think about. And I know we have various subgroups in our task force. Everyone is supposed to be, is invited to be part of one of these subcommittees. And one of them is on health, and they've done presentations in all the hospitals. And I know in one of our local hospitals, the emergency department had the training, and they set aside almost a room. If they recognize someone who is a victim, they explain to the person usually accompanying that person that they need to do an exam on their own, get that person away, and they're able to hold that person even for a couple of days in that room until they find a safe venue for that victim. So that's a thought.
Thank you. I think the other thing we've learned is that with any entity or organization, you can't do this by yourself. You need that connection with others in the community to provide whatever services you provide, because nobody has all the resources, nobody has all the expertise. And so it takes all of that, and building those relationships again is a key factor, so that when you do need the help, you know whom to call, and that person on the other end knows what to address. Nancy asked another question: is your focus primarily human trafficking versus prostitution? We address human trafficking, whether that be sex trafficking or labor trafficking, and we don't label the sexual exploitation necessarily as prostitution, although some still do. And our law enforcement friends are realizing, let's not call that person a prostitute. Let's consider whether that person might be a victim. So we don't use that term in the work that we're doing. Although some persons, individuals may decide that that's the work that they are doing, what they call sex work. And that's their privilege to say that, but that's not the terms that we're using, and we're not judging them for what they have chosen. Any other questions or comments?
We have a labor trafficking coalition in our county, and it does bring together some strange bedfellows.
Mhm.
So we're working with wage and hour officers from the Department of Labor, migrant legal aid. We're trying to include the migrant ministry peoples. And so it's a different flavor and a
Sure.
different experience, and lacking access to the victims
Yeah.
is a primary issue
Mhm.
of other than the migrant workers, farm workers. It's very difficult to identify and find the victims,
Yes.
more so than in the sex trafficking. But it's becoming a good working group together.
Yeah. That's an area that the whole nation doesn't do a good job yet, is with labor trafficking. So,
And I think a reason for that is that sex trafficking is sexy. But labor trafficking is something that we are far more involved in being responsible for as consumers.
Yeah.
There's very little on our table or on our backs that does not make us part of the labor trafficking reality. So the public awareness on that issue is very important, and is also somewhat difficult, particularly with clothing.
yes.
I mean, we know the large areas, but we don't know who made Sag Harbor, which
Mhm.
most of us bought at Myers.
Yeah.
I don't know if anyone has any suggestions, but I know part of the problem we have with labor trafficking, or that I experience, is that a great deal of it there are some people trafficked who are in the agricultural industry and domestic workers, but a lot of it is overseas, and people want to focus on this city, this county. And so it's very hard to get even our task force to focus on labor trafficking.
I just want to comment also on labor trafficking, okay, because one of our organizations that we support are really working with migrants, and there's a lot of labor, and they can infuse it with people there to help them, but there's a lot of labor trafficking that's happening, especially in the rural area where most of the farmers hired, I don't know if they're legal immigrants, but it's a reality in most of those places. And so I know from our organization who work with us, with the migrant workers and like that, and that's what they discover, a lot of labor. Sometimes they're not getting paid normally, and there are sometimes they withhold if they find out that they did something. It's really like a slavery, but it's really labor trafficking.
Jean, you have something?
Yes, one of the Dominican hospitals in California took a health van out to the ag fields so they could contact the migrant workers on the pretext of health checks. But what they were really also doing is inquiring as to their labor situation and giving them information on resources that they could contact if in fact they were being trafficked. So it was kind of an undercover operation being done through the healthcare system. And I thought that was a very creative way of doing things.
Thank you. And Lynn, in
Another
order
piece
to
there.
address, I'm sorry, Lynn, in order to address your question, I agree that it's difficult to raise awareness around labor trafficking. One of the things I found pretty effective was, you may have heard Terry Coonan last night offer the slavery footprint as a tool and an incentive. I've used that in presentations because if people will take that challenge and do that, they're amazed and they're pretty shocked. And it
Yeah.
raises awareness in a way that perhaps something else wouldn't. And they become aware of the fact that they're participating in this trafficking every day in that supply chain. And in
I think
terms
I'll
of
go
what's,
back to that again.
yeah,
And because I tried that a few years ago with the task force and I think 2 people did it. But I think it's worth, thank you for bringing that up again. Yeah.
and I know it's hard for people to even see it in their own neighborhoods, but just asking the questions. Why is that person not in school? Maybe they're trapped in the home. So it's that awareness. It's not wrong to be a nosy neighbor, so to speak, in those regards. But it's going to take time. I don't think we're yet at a point where we do labor trafficking very well at all. Bridget, I interrupted you.
Yes,
Sorry.
the labor trafficking, I think if you're not in communication with your investment people from ICCR or your CRIs, lots and lots of activity going on supply chain and forced labor is happening in the investment area.
Yeah.
So check in with your SRI people in your communities.
Thank you.
And lots of webinars that are coming out of ICCR on supply chain and due diligence and the like.
Are there any other questions? Well, we're right at the ending time. And so I thank you very much for your attention, for your interest, for your concern about this huge issue. And I wish you every success in building and participating in the coalitions that are surrounding you so that they can be very effective in addressing this crime that's so pervasive and takes all of us to do something about. So thank you for allowing me to speak to you today.
Thank you, Anne.
You're welcome.